Okay, this is the subcutaneous return for Lainey Adams. I'm in my correct uniform, my badge, stethoscope, pen and pen light. Here, watch, wearing shoes. Gonna start out in the med room, which I have right here. I have all my supplies. I'm going to locate my MAR, which is right here. Fanny Fundamentals, receiving heparin, 1,200 units. So I will wash my hands and locate my vial. I'm going to choose the 10,000 units per milliliter heparin. That's this guy right here. And that will end up being 0.12 milliliters. So then I'm going to choose a syringe. I'm going to choose the tuberculin, this little guy. And I'm going to do my 6 writes and write my label. So we have Fanny Fundamentals, 11,355, receiving heparin, 1 in 10,000 strength, 1,200 units subcutaneous, 0.12 milliliters, added by me on 11/18/20 at 1,300 hours. It expires on 02 of 2028. And I'm going to get ready to draw up my medication. Alcohol swab. And I'm going to clean this for 15 seconds in my vial. Okay. Then I'm going to get my syringe. Take off my cap. Going to inject some air into the vial first. Drop my medication. Get out any bubbles and get to my right dose. Right there. Okay. To recap that, I'm going to do my 6 writes again before I attach my label. So Fanny Fundamentals, 11,355, heparin, 1 in 10,000 strength, 1,200 units subcutaneous, 0.12 milliliters, on 11/18/20 at 1 o'clock, added by me. It is not expired. My syringe matches my dose. I'll do my best to show you here. Okay. I'm going to attach my label. Just like this. Then I'm going to go to my patient's room. So I would get to the room, knock, wash my hands. Hi, I'm Lainey. I'm going to be your nurse today. Can you verify your name and your date of birth for me, please? Okay, that matches. Do you have any allergies to any medications or latex? No? Okay. We're going to give you your heparin today. So I'm going to perform my 6 rites again. Fanny Fundamentals, 11,355. Heparin, 1,200 units, subcutaneous, stat, so that is 1 p.m. 0.12 milliliters. This is not expired. I'm going to loosen up the lid on here. Get on my gloves. And I'm going to choose a site. Subcutaneous can be given in the abdomen, in the back of the arms, the thighs, or underneath the scapulas. Heparin has to be given in the abdomen. I'll be sure to choose a place that is at least 2 inches away from the umbilicus and 1 inch away from any contusions, injuries, tattoos, anything like that. To get an alcohol pad, I'm going to bunch up my area. Clean it in a circle, starting in the center and moving outward. I'm going to let that dry. Then I'm going to get my needle. Okay, you're going to feel a small poke. 90 degrees. Inject slowly. Hold for 5 seconds. Release the bunch, withdraw the needle, activate the safety device, throw that in the sharps container, check for any bleeding or oozing and handle that with a small gauze pad. Remove my gloves, throw away my supplies, wash my hands, and I am finished.